Hello, everyone. Good evening. We had a great time in the comment section. Everybody is very responsive in the comment section. So everybody's meeting again. And obviously, for tonight, we have a lot of students, really a couple of students who passed the NCLEX. So congratulations to all of you, everyone. We have Charlize, Brar also passed the NCLEX, and we also have another person, Timotopy, I think, passed the NCLEX as well. So we have three people who passed the NCLEX already. So thank you very much, and I hope that the Matus Nursing Review Online NCLEX Academy has helped you. You are my students online, and then also my book, and then also our Thursday live over here. And for you to stop at 60 questions for your NCLEX, that is a good achievement because it means that you did very well in the examination. So thank you guys. If you have time, if you can make a recommendation or review in my Facebook page, I would appreciate it, and we can share that to your classmates as well so that they will benefit from your testimonials. Okay, so thank you very much. Before anything else, again, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I'm also a nursing faculty, and I have been teaching nursing students for almost 25 years. I'm also the founder of Matus Nursing Review and Matus Nursing Review Online and NCLEX Academy. And also, I'm an author of a book, the Simple, Fast, and Easy NCLEX Review book that you can get from Amazon. Thank you very much, everyone. So let's go and proceed to our first agenda for tonight. We're gonna have again your questions, prioritization, and delegation. So some students are asking me, are you going to have other topics later on? Maybe in the future, but for now, we focus more on delegation and prioritization because it seems like it's helping a lot of students. So we welcome everyone. So we have Joe Balsky tonight. So Joe, welcome here. She's also our student in the online NCLEX Academy. Okay, so we also have Miriam. So Miriam, hi to you as well. Then also we have Hilda. Okay, Hilda Asuncion as well. Kadiato is also here. Truali, she's here for tonight. And then also we have Amber. Okay, Amber Liu. Okay, and then of course I cannot catch up with all of the comments, everybody. Okay, but please, if it's okay with you, if you can share this with your friends so that they will also benefit from the Facebook live that we have. Okay, so what is our first agenda for tonight? We're gonna have, okay, um, I just learned recently that Kermaljit passed her NCLEX, so she sent me a message, and I'm really very happy for her because she finally passed her NCLEX. It's NCLEX-RN, so she passed the September 2020. So congratulations to Kermaljit, and of course the others. So just let me know in the comment section that you also passed your NCLEX examination. So congratulations, congratulations. All right, another one that we have for tonight is going to be our testimonial. So this testimonial is something that I have not shared with the group yet. So the testimonial says, this is from one of our recent pastors this month, or last month actually, September. Um, this is Mariflor, and she said that the Facebook live videos on prioritization delegation really helped out a lot. His book is also great. Apart from that, Sarmatus is very facilitating and accommodating. He is a motivator and personally replies to emails, which makes you feel how devoted he is as a mentor. So thank you, Sarmatus, for being an inspiration. So thank you very much, also Mariflor. And if I can remember very well, Mariflor is from the Kingdom of Saudi Arabia, I guess, or what I think Middle East. Yeah. So we're helping out students across the world, and this is a good testimonial from Mariflor. So congratulations also for passing your NCLEX this month, September. Okay. So again, for tonight, we're gonna have your free 90-day online access NCLEX review winner. So at the end of the session, we're gonna announce again the winner for tonight. So hopefully you're all excited, everyone. Can you say yay? It's exciting in the comment section. We're gonna announce that at the end of the session for tonight. So we're giving away another 90-day, free 90-day online access NCLEX review, and that includes all of the videos, my lecture videos, as well as all of the recorded videos of this live every Thursday. So you'll be able to access that in one place, and it's going to be helpful in your NCLEX review, everyone. Okay. All right. So my first question is everyone ready for for our first question for tonight? Okay. But before everything else, I want to ask, what do you think is our topic for tonight? So I said in the comment section that our topic for tonight is is starts with letter F. Okay, so letter F is the first letter for tonight's topic, or the focus for tonight. So what do you think is that? It starts with letter F. What disease condition is that, everyone? Disease condition. What disease happens in the month of September, starting September, October, let's say November, December, January, February, March, April. So what disease condition is that, everyone? So we're talking about, okay, can someone guess? It starts letter F, followed by letter L. Okay. So what do you think is that? Very good, Faye. So Faye again got the right answer. Last week she's the one who got the right answer also when we had coronavirus. It's gonna be your flu. And if you don't know, everyone, flu is a big part of my life, because when I used to work in a hospital as a nurse educator, my big project was on flu prevention. So I helped educate nursing facilities, or I educated nursing facilities on flu prevention, and then also on how to enhance compliance with flu vaccination. So it's a big part, and I have worked with different departments in terms of really understanding what the flu is all about, and held conferences and workshops about it. So tonight we're going to learn a little bit about flu. And is flu going to be in the NCLEX? Possibly, because it's a common disease condition, definitely. Okay, so flu season. So let's have the first question for tonight. Say yes, everyone, in the comment section. And also, just to let you know, everyone, we have placed some links. Some students were really asking us questions after the Facebook Live about some of the products, or how to enroll. Now, what you can do also is to scroll over the first comments in this Facebook Live, because we have placed there the links for the products, and also for the enrollment, if you're interested, everyone. Okay. All right. So let's have the first question for tonight. And as usual, you're gonna have four patients. Now, four patients. Some students who took the NCLEX recently told me, like, Sir Alan, you're exactly correct. A lot of prioritization questions, a lot of delegation questions, and most of these prioritization questions that were given for patients, and we need to pick who is the most stable, or who is the most unstable patients as well. So it really helped them. So yes, Temitopi said that it was in her NCLEX, and we all know that, because prioritization delegation is a big part of the NCLEX. It's in the test plan. All right, so let's have the first question for tonight about your flu, everyone. So the first question is going to be this one. Okay, so number one, several clients with flu are waiting to be seen in the urgent care clinic. So which of the following clients requires immediate attention? A, the 25-year-old client who reports generalized body aches. B, the 35-year-old client who states that coughing started during the night. C, the 19-year-old client who complains of scratchy and irritated throat. And D, the 50-year-old client who experiences tightness in the chest. Okay? So which client here requires immediate attention? So you have several clients with flu are waiting to be seen in the urgent care clinic. Which of the following clients requires immediate attention? A, the 25-year-old client, okay, who reports generalized body aches. B, the 35-year-old client who states that coughing started during the night. Letter C, the 19-year-old client who complains of scratchy and irritated throat. Or letter D, the 50-year-old client who experiences tightness in the chest. And of course, in this question, you will start again with the airway, breathing, and circulation. But again, do you see that in this question? Any concerns about the airway, breathing, and circulation? Okay, so just remember, Okay, just remember A, B, C, or D. All right, so what could be the answer? So let's go to the answer immediately, everyone. Most of you answered. Okay, so let's see. All right. So for this question, what's very important for you guys is to know the signs and symptoms of your flu and to find out which ones are complications. So you have your chest tightness. Okay, most of you are answering that, but what about the others? Okay. So the answer to that question, everyone, is going to be okay. Very good, everyone. That would be your letter D. So congratulations, guys. Why is letter D the answer? Because letter D is actually one of the signs and symptoms of complications whenever someone is having flu. It can indicate problems with the heart due to cardiac complications. Although we all know that flu can definitely cause pneumonia, right? Now we also have letter A, generalized body aches. Letter A is not the answer because body aches would be expected in patients with flu. B, coughing is part of the manifestations of flu. Letter C, sore throat is a manifestation of flu as well. So just go back. Um, yes, Timotopy, your lectures really helped me on my exam. So thank you very much, Timotopy. Okay, thank you for the feedback. So just kind of like giving you an idea, everyone. This is what happens when you have a flu. So you have your flu symptoms and complications from the Centers for Disease Control and Prevention. So remember that influenza can cause mild to severe illness and at times can lead to death. Flu is different from a cold. Flu usually comes on suddenly, and people who have flu often feel some or all of these symptoms. So number one is going to be your fever or feeling feverish or chills. You have your cough, you have your sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, or tiredness. And some people may have vomiting and diarrhea, though this is much more common in children than in adults. It's important to note that not everyone with flu will have a fever. So complications of flu will be pneumonia, myocarditis, and encephalitis, and that's why it's very important to report chest pain or pressure in the chest because that may indicate the presence of pneumonia or myocarditis. Okay, and an easy way to remember your flu, everyone, is going to be the acronym FACTS. Okay, so FACTS is an easy way to remember the signs and symptoms of flu and to differentiate that from colds. So when we say facts, F stands for what? It stands for fever, A stands for aches, C stands for chills, T stands for tired, and S stands for sudden onset. Because the symptoms of flu would be sudden in onset. So remember that. Okay? So facts again would be fever, aches, chills, tired, and sudden onset of symptoms. All right? So remember the signs and symptoms of flu, everyone. So I hope that you have learned in this rationalization. Okay? That's why the answer to this question is going to be letter what? Letter D, everyone. So good, everybody got the right answer. So maybe that will be in your NCLEX. Very easy question, and then you got it right, and the computer will love you for that. Okay? So let's proceed to the next question, everyone. Another flu question. Okay? All right. The nurse administers flu vaccines in the clinic. Which client requires priority intervention after the vaccine is administered or given? A, the 15-year-old client who reports soreness of the shoulder. B, the 28-year-old client who states that the injection site appears swollen. C, the 25-year-old client who complains of muscle aches. Or D, the 43-year-old client who develops a high-grade fever. Okay, the nurse administers flu vaccines in the clinic. Which client requires priority intervention after the vaccine is administered? A, the 15-year-old client who reports soreness of the shoulder. B, the 28-year-old client who states that the injection site appears swollen. There's C, the 25-year-old client who complains of muscle aches. Or D, the 43-year-old client who develops a high-grade fever. Okay, so find out what's your answer, everyone. And before I forget also, while others are answering, I would just like to remind you that flu is caused by different viruses. You have your flu type A virus, and then you have your B virus as well. And we put these viruses in the vaccine in a weak form so that we stimulate the immune system. Flu actually is infectious a day before the symptoms appear. So remember that a day before the symptoms appear, flu is a person can be infectious. And after the person gets flu, the person could be infectious for the next 5 to 7 days. So remember that, everyone. And what is the transmission of flu, everybody? What is the route of transmission of flu? Can you let me know how do we transmit flu, everyone? Okay, can someone let me know? What's the transmission of flu? Okay, what's the route of transmission? Or is it airborne? Is it droplet? Or is it contact? Okay. So basically, the number one way that we or method or mode of transmission for your flu is going to be definitely it's going to be droplet. Okay, it is not airborne. So it's going to be number one. It's going to be a droplet infection, everyone. Okay, so very good. All right. So let's proceed to the answer to this question, everyone. All right. And of course, how do we diagnose flu? We actually do the nasopharyngeal swab testing, okay? And then also our treatment for flu for some patients, especially high risk, we give them antiviral medications, okay? Antiviral medications such as Tamiflu, we should be given immediately, okay? Or within a certain number of hours, all right? And flu is self-limiting, meaning that it just goes away, but you have to treat the symptoms because flu can also have complications, so that's why rest is very important, as well as hydration, a good sleep, and nutrition as well. Okay, all right. I have a question to everybody before I show you the answer to that question. At what age can we start receiving the flu vaccine? Okay, at what age do we receive flu vaccine? Starting at what age? Okay, what age do we recommend having your flu vaccination, everyone? Above what age? Okay, age, all right, everybody. What month? Okay, 6 months and above. Very good. So 6 months and above will be the administration of the flu vaccine, everybody. 6 months of age. Very good. Okay, so the answer to that question that you just answered, everyone, is going to be, okay, all right, so we have this. Okay, so we have the answer is going to be letter D, everyone. So that's going to be the patient who develops a high grade fever after the administration of the flu vaccine. So the nurse administers flu vaccines. Someone with a soreness of the shoulder after administration of the vaccine, that would be an expected side effect. Another one would be the 28-year-old client who states that the injection site appears swollen. That would be a side effect of the vaccine as well. Letter C, the 25-year-old client who complains of muscle aches. That would be also an expected side effect. So the answer is going to be letter D, the 43-year-old client who develops a high-grade fever. Yeah, so that's very good. Exactly. 6 months would be for inactivated virus. I would like to make sure of this, everyone, because you have your live influenza. Okay. And we have to be careful with your live influenza, especially for immunosuppressed patients. So what we have actually is the inactivated form, okay, that we usually give at 6 months and above, okay, usually for infants, and then ages above that as well. Okay, so just to make a distinction that the flu vaccine comes in different forms. Okay, so thank you very much, Eva, for that information. Okay, now, so the 43-year-old client who develops a high-grade fever, because this is the rationale. Okay, all right. So when someone has flu, or after the injection of the flu vaccine, okay, common side effects from the flu shot will be soreness, redness, and or swelling from the shot. And I think that you have to somehow think that this could be the same thing for the other vaccines as well. So you have your headache, you have your fever because your immune system is responding, you have nausea, you also have your muscle aches. And then if I'm going to ask you, how long will it take for the flu vaccine to give you protection? Because the protection for the flu vaccine is not going to be overnight, it's going to take a while. So, for how many days are you going to wait, or how long will it take before you get 100% possibly protection from the flu? The answer to that is actually going to be 14 days, everyone. Okay, so remember that 14 days, that's the minimum number of days wherein flu can give you full protection. Okay, the signs of a severe allergic reaction after flu vaccination will be difficulty breathing, hoarseness or wheezing, swelling around the eyes or lips, hives. You also have paleness, weakness, and a fast heartbeat or dizziness as well. So remember this, everyone. Okay? So the answer to this question is going to be, all right, letter D, because a reaction to the flu vaccination, yes, fever can happen, but we only expect low grade fever. A high grade fever can mean, okay, can mean something is going on, or a severe reaction probably from the vaccine, everyone. Okay? So if you have any questions as well, you can put that in the comment section. Somebody actually was asking if I could explain further the facts or FACTS for flu. So just remember that for flu, the symptoms of flu that differentiates it from colds will be flu has fever, aches, chills, fatigue or tired, and letter S, the sudden onset of symptoms. Okay? All right. So now let's proceed to our next question, everyone. Okay, so that's all about your prioritization question. Okay, and if you go to my YouTube channel, then you can find also most of these videos that we have here. So please watch the videos and then subscribe in my YouTube channel as well, everyone. I will appreciate that. Okay, so now let's proceed to our delegation question, everyone. Are you ready? Can you please say yes in the comment section? And also, I would like to find out from which country or state are you coming from tonight, because I want to find out where my students are coming from, and I'm really very happy that you're participating here. And of course, we call ourselves here Matus Tribe, okay? But it's a sense of community, and of course, we're helping out students, and that's the greatest achievement that we have in doing this, okay? So you can say what state or country you're coming from, everybody. I would appreciate that. So let's go to the first delegation question that we have, everyone. Okay, so the first delegation question that we have, you need to master these concepts. Okay, so you always say that, oh, it's always delegation and prioritization. However, remember that it's better to overlearn and to learn these concepts before you take your NCLEX, everyone. Okay, all right. And I explained the topics anyway, so wow, so everybody's saying yes. Okay, I cannot catch up with the comment. Everybody's just really, wow, a lot of comments right there. Okay, so let's read the question, everyone. The registered nurse and licensed practical nurse administer flu vaccines in the medical surgical nursing unit. Which of the following tasks may be assigned to the LPN? Select all that apply. A. Inject flu vaccines intramuscularly. B. Obtain temperature flu before flu vaccination. C. Develop a teaching plan to enhance vaccination compliance. D. Reinforce teaching on the importance of flu vaccination. E. Evaluate a client's response to flu vaccination. And F. Report adverse reactions to the registered nurse. Okay, so let's read the question again. Okay, all right. The registered nurse and licensed practical nurse administer flu vaccines in the medical surgical nursing unit. Which of the following tasks may be assigned to the LPN? Select all that apply. A. Inject flu vaccines intramuscularly. B. Obtain temperature before flu vaccinations. C. Develop a teaching plan to enhance vaccination compliance. D. Reinforce teaching on the importance of flu vaccination. E. Evaluate a client's response to flu vaccination. And F. Report adverse reactions to the registered nurse. Okay, So what's the answer, everyone? Most of you have similar answers, and I think that's really very exciting because it means that most of you are really getting the answers right, probably. Okay? So again, do not delegate it. Evaluation, assessment, and your teaching, everyone. Okay? So let's have the answer, everyone. Are you all ready for the answer to this question? Okay? So let's see. Okay? Always remember, RNs do not delegate your evaluation, assessment, and teaching. And when it comes to assessment, okay, that would be your comprehensive or in-depth assessment or initial assessment should be for the RN, okay? And then your LVNs or LPNs can do specific assessments, all right? Like auscultation of the vowel sounds, and I'll explain more about that later on. But the biggest question that we have here for tonight is what about education or teaching? Can LPNs teach? That's going to be the question, everyone. Okay? All right. So let's proceed to the answer to this question, everybody. Okay? The answer to the question, everyone, is going to be very good, everyone. So I think most of you got the answers right. So that would be your A, B, D, and F. Very good. Okay, so Joe said that LPNs cannot teach but can reinforce teaching. Or LPNs can also teach as long as it is more of a simple teaching only, routine teaching. It's not complex. Okay, and I'll go over that one by one right now. Okay, so, injection of flu vaccines. So, remember that injection of flu vaccines intramuscularly is within the scope of practice of the LPN, and that is okay. Am I right? Letter B, obtain temperature, of course, vital signs measurement or gathering of vital signs. That's within the scope of practice. Okay. Letter D, reinforce teaching on importance of flu vaccination. That is, of course, included. Okay, the importance of flu vaccination when you reinforce the teaching. So, meaning that initially, who should be teaching the patient on the importance of flu vaccination? That would be the registered nurse. However, the LPN can come over and reinforce the information if there is any problem with the understanding of the patient in terms of the vaccination, if the patient has a lot of questions, for example, there's a misunderstanding or a misconception, then the LPN has to report that to the registered nurse. So the registered knows that there is a lack of information or knowledge. Now, another example of reinforcing teaching for the LPN could be, for example, the wound dressing or wound change, for example. So after the RN explains or teaches the patient how to do self wound care, for example, then the LPN can reinforce teaching on the importance of hand washing. Okay, hand washing when caring for the wound. So that's where the LPN comes in, teaching routine, simple education, more of reinforcement, everyone. Okay, all right. We do not want to say that LPNs cannot teach. You know why? It's part of the nursing program. We teach LPNs. Is a healthcare worker. So definitely we teach. But however, in terms of comprehensive teaching, in-depth teaching, and of course independent teaching, then that would be the registered nurse. Especially, what if the patient has a new device, or a patient is going to be discharged with a newly constructed colostomy, for example, or it's a complex device, for example. So that would be the registered nurse. Okay, so you always have to be guided by the principle, which is asking yourself, is it a complex teaching or is it a simple teaching only? All right. If it's complex, then you have to give that to the registered nurse, of course. Okay. Now, letter F, report adverse reactions. Definitely, the LPN wants. The LPN notices that there's reactions to the flu vaccine that needs to be reported, definitely. Your letter C, developing a teaching plan, is a complex process. It is a complex responsibility. Then, of course, we have to give that to the registered nurse. Okay, and then evaluating a client's response to the flu vaccination, of course, is the responsibility of the registered nurse to find out what's going on with the patients. How are they reacting to the flu vaccines? Okay. So very good. So let's see some comments here. So Maria said that LVNs can reinforce teaching. Definitely. Actually, when it comes to that one, you world actually mentioned that as well. And then also remember that when it comes to assessment, we have discussed this here many times. That can LVNs assess? Sometimes you say no. LPNs can assess. Okay. But however, when it comes to comprehensive, in-depth, or initial assessments, it has to be the registered nurse. If it is comprehensive, complex assessment, head-to-toe assessment, for example, then that would be the RN. But when it comes to specific or focus assessment like auscultating bowel sounds, getting the heart rate, noting the color of stool or the urine, for example, then that would be okay for the LPN to do. Okay, specific assessments, and that is also coming from you world, everyone. Okay, all right. So I hope that you learned something, everyone. But I'm really very happy because most of you got the correct answer on that one. All right. So, and also Sonu said, "How I wish I'll be the lucky one to win one day." So we'll find out. All right. So let's have the last question for tonight, everyone. Okay. All right. So let's have the last one. Okay. So NCLEX challenge question again. All right. So I hope you're learning something tonight, everyone. And if you can put in the comment section, so far, what are you learning tonight, everyone? Is there something new? Okay. So far, what I know is that we're learning something about flu tonight. Okay. Let's proceed. The registered nurse works with the unlicensed assistive personnel, okay, or UAP in the clinic. All right. Which of the following tasks can be delegated to the UAP when giving flu vaccinations? Select all that apply. A. Distribute consent forms for completion. B. Discuss the purpose of flu vaccination. C. Ensure understanding of information in the forms. D. Provide directions to the vaccination area. Or E. Check the injection site after flu vaccination. Okay? The registered nurse or RN works with the unlicensed assistive personnel or UAP in the clinic. Which of the following tasks can be delegated to the UAP when giving flu vaccinations? Okay, select all that apply. A. Distribute consent forms for completion. B. Discuss the purpose of flu vaccinations. C. Ensure understanding of information in the forms. D. Provide directions to the vaccination area. And E. Check the injection site after flu vaccination. And I would like you to put later on, what is your score out of 4? Did you get 4 out of 4, 3 out of 4, 2 out of 4, or 1 out of 4? Okay, so again, let's go back to this. Use the process of elimination. Always be guided, simple, within the scope of practice, and stable patients. Okay, so what will be the scope of practice of the UAP? And let's presume, or let's assume that all these patients are stable, because in the first place you cannot delegate a client who is unstable to a UAP. Okay, so all right, so the answer to this question while the others are answering, everyone. Okay, so it's a highly challenging question, but always remember, be guided by the principle that we always discuss in this live. Okay, within the scope of practice, it has to be simple, and at the same time, it has to be a stable client. Okay, all right. So the answer to this question, everyone, is going to be letter. Okay, so let's see. The answer is going to be letter. All right. So the answer is going to be letter A and D. Okay. So A and D, everyone. So letter A, that's within the scope of practice of the UAP. Distributing consent forms for completion is very easy. All you have to do is just hand them over to the clients who come in. Okay. So distribute consent forms. That will be letter A is included. Letter D, provide directions to the vaccination area. Of course, we can include that. That's a simple responsibility. But letter B, discussion of the purpose of flu vaccination is for the RN. Ensuring understanding of the information in the forms is going to be the RN also, especially if patients have questions about the contraindications to the flu vaccination. A lot of patients, when they come in, they will have a lot of questions. Sometimes they will say, if I get pregnant, can I get the flu vaccine now? If I have allergy to eggs, can I have flu vaccinations? Sometimes the question will be, what if I'm very sick right now, or I have fever, or I have cough? So can I get the flu vaccine? So ensuring understanding of information in the forms is the responsibility of the RN. Letter E, check the injection site after flu vaccination. Of course, that is the responsibility of the RN. So Faye said that she got 4 out of 4. Congratulations. Okay. Okay, so Amber said that it is worth her time. Thank you. So great topic, as flu can always be mistaken as well as COVID. So last week we discussed about COVID, everyone, and also sometimes we think that flu is like colds. However, they're actually different, especially when it comes to the manifestations. And flu can really be very very serious, everyone. Okay, all right. So thank you very much, guys. So I hope that you got 4 out of 4, and then we are now on our way to proclaim or announce the winner. But before that, just really very quick, and everything is in the link here. Again, our program, guys. Just to let you know, we have the Matus Nursing Review online NCLEX Academy, and we do have self-study programs and then also live webinars. So go and visit the website matusnursingreview.com and see the programs that we have. Okay, and also we have of course, my favorite part is introducing the workbook, and I was sending workbooks today and yesterday, and students have been taking pictures and sending that to us. So the workbook is 94.50 and $49 per month for online subscription. At this time, this is the price. We don't have any promo right now. So the total for your review is only going to be 143.50, and it also includes already your access to the online academy, everybody. Okay, all right. So let's see what the other people are saying here. So 4 out of 4 today with your online lectures and your workbook. Thank you very much, Pratixa. Thank you. Okay. Um, all right. So we also have another one. Of course, everybody knows that I have my published book in Amazon. Okay, if you want to order in the Philippines, then you can just email Matus Nursing Review Academy at gmail.com, everyone. Okay, so that is my book. So I actually have the book here, everyone. I think that it looks very nice, though, right? Very simple to read. Okay, if you see the contents, everybody, it's very simple to read and easy for the eyes. Can you describe, whoever has my book, can you describe in one word? Okay. How do you find this book, everyone? Can you put that in the comment section before we reveal our winner for tonight? Whoever has the book. How can you describe the book, everyone? So I'm really very proud of this book because it took me years to finish the book, and students love the book because it's really very simple, fast, and easy. Okay. So all right. So thank you. So Renally said before we end for tonight, okay, so be confident in taking your exam. Of course, I'm really very happy I'm helping you guys. Okay. So let's announce the winner for tonight. You better get ready, everyone. Okay. Okay. So Cherry said going back to buy that book. Okay. So thank you very much, Cherry. All right. Great content. So Marilu said, okay. Hi, Marilu. How are you doing? Okay. So Marilu is here. Okay, nice to see you. All right, she's our student, and Alan Hill's story. Okay, so this is a little bit touching, heartwarming. She said that book is like a holy Bible. I love it. Okay, thank you very much. Okay, so that's really very nice comment. All right, every session is worth learning. Thank you. Okay, so all right, so we have to conquer the bees. And again, Charlize, congratulations for passing your NCLEX. And I'm doing all of this, everyone, because I want you all to get inspired and pass the NCLEX. And I would like you to hear the story of your classmates, because if they can do it, you can also do it, everyone. The secret to the NCLEX is to master your content and to find the right resource for you. And I would say that you can use other resources, definitely, because that helps you in your learning process. Okay, maybe my program has helped you a lot, but I know also that other programs may have helped you as well. Okay, All right. And Gian said she really loves the book. Okay. So Ramonita as well. So they're buying the book. So thank you very much, guys. Okay. All right. So let's announce the winner for tonight. Okay. All right. So our winner for tonight is going to be. Okay. So I'm so excited. Okay, Kadiato Trawali. I think she was here or he was here earlier. Okay. So congratulations. You are the winner of the free 90-day online access NCLEX review. And I would just like to let you know, Kadiato, that we do have winners of this online access academy that actually passed the NCLEX. Charlize is one. Miss Brower is also one. She also had access to the online academy. I think they won. Okay. Congratulations to Kadiatos. Please say your congratulations to Kadiato, everyone. And I'm so excited again to have another session with you next week. I'm gonna have to think of something that's really very exciting so that all of you will benefit from the program. Okay? So, again, it's Mr. Matus, and my purpose is to make your NCLEX review simple, fast, and easy, everybody. So, thank you very much, everybody, and have a great night. Thank you, guys.